Hello everyone, welcome to another Upgrade Your OET vocabulary quiz by Bose Learning. Today's quiz is, what does it mean if someone says that they're feeling peaky? Well, it's nothing to do with mountain peaks, but it's actually an adjective. For example, if a patient tells you about their baby and they say, the baby, or she's been feeling peaky for 3 days now. What they mean is that the baby has been unwell, maybe the baby looks pale and unhealthy, and maybe the baby is not settling and not feeling comfortable. You can use it for adults too. It's not necessarily an adjective just used for babies. This is just an example. But basically it means that if you're feeling peaky, you're not feeling well, you're not looking well either. So we'll stick with the baby idea and look at what the NHS website recommends. I'll be picking out some interesting vocabulary and pronunciation for you as well. So according to the NHS, in children under 5, a fever, so the pronunciation here is fever, is considered to be a temperature of 38 degrees or above. So I think in most of Europe and the world, in fact, we use Celsius, whereas in America and in some other countries I know that Fahrenheit is still used, but we would just say 38 degrees or above. We don't need to say plus here, we just say 38 degrees. Fever is very common in young children, and more than 60% of parents with children in that age range have said that their child has had a fever. It's usually caused by a minor viral infection. Just be careful of that hard V there, viral. So you need to bite your bottom lip when you say it, viral infection, such as a cough or cold. The pronunciation here is cough or cold, and this is something that can normally be treated at home. Of course, a high temperature can be worrying for parents and carers, but most children recover with no problems after a few days. Let's look at the guidance on what to do if your child is feverish. So again, let's look at some words that you can use when you're giving your patients advice, and we'll look at pronunciation. And again, we'll look at these words which are not so medical, but they're more lay terminology. Okay, so of course you can tell them to encourage the child to drink plenty of fluids, offer regular breastfeeds if the mother is breastfeeding, only offer the child food if they want it. Look out for signs of dehydration. Dehydration. The R in British English is very soft, dehydration, and this can include a dry mouth, no tears, sunken eyes. That's when the eyes seem to be a little bit inwards, they're not so prominent, they're a little bit reduced. And in babies, fewer wet nappies. In Britain, we say nappies, in America, they say diapers. The advice is to check on the child from time to time during the night to keep them away from childcare or school. There's also the advice that there's no need to undress the child or sponge them down. So that's using a sponge to wet them with tepid water. And this is because research shows that neither actually helps reduce fever. So that's not really recommended. And if your patient asks you about that, you can tell them. Avoid bundling them up in too many clothes. So bundling them up is a really nice expression, which means wrapping them up too tightly. So you don't want to be doing that. You don't want to be bundling them up in too many clothes or bedclothes. Of course, if the parent is worried about the baby or child, then it's very important that they call the GP practice. And if it's closed in the UK, to call NHS 111 or contact the out-of-hours service that the GP would have provided them. Okay. So as we said, a high temperature can be quite worrying for the parents and carers, so you're going to have to be very sympathetic and reassuring to the parents and tell them that most children recover with no problems after a few days. And a really nice expression that you can use, an idiomatic one, could be, she'll be right as rain in no time. Okay, so right as rain is a nice idiom which means she'll be absolutely fine in no time. The fever will disappear by itself with a few days rest and TLC. Thank you very much for watching. If you are interested, we've got a very special offer for you on our on-demand medicine speaking course, which takes you through the OET speaking criteria. It gives you a language practice library and also some help and guidance with how to upgrade your OET score. That's available on our Udemy partner site. All you have to do is click on the link below and you'll get yourself an amazing discount. Thanks very much. See you again next time. Bye bye.